So what exactly were the concerns with regards to this particular app in Norway?
So over the past month, Amnesty's been analysing contact tracing apps from Europe and the Middle East. And through that analysis, we found that Norway was amongst the most privacy invasive apps that we had surveyed. And that's because Norway's contact tracing apps, along with Bahrain and Kuwait's contact tracing apps, it carries out live or near live tracking of users' locations by frequently uploading their GPS coordinates to a central server. So what this essentially means is that people's who have downloaded the app, their location is transmitted to a government database in real time. So almost acting like a mass surveillance tool. And so as the Norwegian's Data Protection Authority found, this is disproportionate interference with the right to privacy. So under international human rights law, in public health crises like this, you can interfere with the right to privacy, but it must be necessary and it must be proportionate to the aim. And so in this case, it was found to be disproportionate to the aim. Often governments were rushing out the most invasive contact tracing apps without considering other alternatives, which can adequately balance the need the legitimate need, I must add, to contain the spread of the disease with privacy. These two things aren't mutually exclusive. And so our concern was that governments were rushing out contact tracing apps that were very invasive from a privacy perspective, but also some of which were flawed from a security perspective, as we discovered in our analysis of Qatar's contact tracing apps at the end of May, which exposed the personal data of millions of people, which could have been accessed by any kind of malicious actor. And so what we're asking governments to do is to make sure that human rights and privacy are at the front and center of their rollout of contact tracing apps. We don't need to sacrifice our privacy in order to contain the spread of the disease, and privacy doesn't need to be another casualty in this pandemic.